بسم الله الرحمن الرحيم. المحاضرة الأولى في الأشعة. Radiology is an art of medical image. First, we use an X-ray. The X-ray it is with high electromagnetic wave. It became the second after the gamma wave. It affects the body either useful effect or harmful effect. What about the harmful effect to the body? First, it affects the embryo inside uterus, causing either abortion or mentally retardation, or causing to the body of the person either carcinogenic effect or affecting the eye with cataract or other harmful effect. So we should be careful when doing an X-ray for the person, any person which not need this X-ray. The X-ray either a plain X-ray or contrast X-ray. Plain X-ray without contrast. So like this X-ray, chest X-ray, it is an X-ray, we call it either chest X-ray or plain X-ray without contrast. Usually the contrast not used in the chest, but we can use a contrast like this contrast, an IVU contrast, intravenous urography. This is a contrast X-ray, or another contrast like this contrast. It is a barium contrast. Barium contrast. This is a barium swallow, and this is the barium meal, and this small bowel barium follow through. And when the contrast taking the large bowel, we called it barium enema. So the X-ray either plain without contrast or with a contrast. And we should protect ourselves because the harmful effect of the X-ray to the body, we should protect ourselves either by a distance or by wearing a special lead apron, which is protect our body to about 95% when it is the lead about 0.5 millim. So the second, we use an ultrasound. Ultrasound is easy, available, cheap, and we can do it at any time, and more useful in obstetric for a pregnant woman, and it is not harmful to the body. And also in the chest, we can differentiate between cystic and solid content. So the cyst, it will appear as a hypoechoic, and the solid is hyperechoic. So this is an ultrasound uses. Other use for ultrasound, also we can examine the abdomen and examining the small part or superficial part like thyroid, breast, and testis. Also we can use it in infant to examining the brain. The third one is the CT scan. CT is a density. CT with the X-ray also. It is also harmful to the body, and we should not do it for any person routinely, except when he need, please, because in the future they said it's about 5% of carcinogenic effect from the using of X-ray. So CT is a density. What's that mean? This is the CT. You see? This is the gas, and this is the soft tissue, and this is the bone. So there are multiple different tissue. Look to this. Zero density, mean fluid. Above 0, 20, it's infarction. We see it in the brain. Above infarction, 40, soft tissue. This is a soft tissue. And this is a soft tissue. So this density is 20, 25. Above, hemorrhage. This hemorrhage, we can see it in the brain also, brain CT. Okay. Above hemorrhage, either bone or calcification. This is a bone, and this is the density above 60, above hemorrhage, so it is either calcification or bone. Below zero, first, up to minus 10, 100 is fat. Below fat is the gas. This is the gas. You see the density of gas? Below 100, up to 1 million, minus. The fourth one is the MRI, magnetic resonance image. Magnetic resonance image is depend on putting the body in electromagnetic field and affect the water in the body, because the body is containing water, so it affects the water in the body and is moving the proton of the hydrogen and changing its position. According to this, it will receive the picture. So the MRI depending on mostly on these two, T1 and T2. T1 meaning the time of repetition and time of echo is low. T2, time of repetition and time of echo is high. How can we differentiate between this T1 and T2 from the film itself? When looking to the film, we can read T1 and T2. It is unavailable, it is hard to see, so look to the fluid and the part we take. The fluid in T2 it will be white, like World War II, water white in T2. World War II, water white in T2. Look to this film. So, because of this CSF and the fluid density, so this is a T2 because the fluid appear white, while this fluid appear black. It's a hyper intense, and this is a hypo intense. So this is a T2 and this is a T1. Time of repetition 500, time of echo 8. This is time of repetition about 4,000, and time of echo it's 100. So this is a T1 and this is a T2. CT and MRI very useful because of multiplanar, and we can see all part and tissue in the body. And the MRI more useful in seeing the soft tissue, also the ligament and the joint. So please don't send anybody to the CT MRI. It is not need, because this with X-ray and it is harmful for the body, and it's about 400 to 1,000 more effect than the X-ray, so more harmful. And the MRI is costly and making the patient, it is not need in a difficult situation. So when the patient need, send for this, and the patient not need, please don't spend the money and spend the time of the machine for this unneeded purpose. The other one is the PET, positron emission tomography. This is a new and is nowadays used in our country. And this is a radioisotope, and with this PET we can use for many purposes. First one for oncology, cardiology, neurology, and musculoskeleton. The most important one in the oncology. What is the indication of PET in oncology? First, to diagnose the tumor, not the tumor itself, but first, before operation, when we diagnose tumor by CT and MRI, by biopsy, before we do an operation, we send to see any metastasis for the disease and for the staging. Second, after operation, to see any residual or any recurrence of the tumor. The third one, there is an hidden malignancy and with the high tumor marker. The fourth one, in oncology, when we see a small tumor, not very good diagnosed by an MRI or by CT, so we send for PET. The last one is the DEXA. DEXA, we use it for bone mineral density and for total body composition and fat content. And outside in USA, they use it for every person above 60 to 70 years, and the person indicated for doing this high risk and need to do a DEXA examination when they are heavy smoker, alcoholic, chronic liver disease, celiac disease, and thank you.